Hello, hello, hello. I am going to add Gaynor, who is coming in to chat about the use of a pessary, especially for prolapse. It is designed for prolapse, so you wouldn't be using a pessary probably unless you have a prolapse. And Gaynor is going to come in a moment, I hope. I hope she can join and talk to us about what is a pessary, why would you use it? Just since yesterday when I did the live about hypermobility, I got a bunch of messages today from people who have hypermobility and prolapse and have really struggled to use a pessary. So I'm hoping we can make the technology work for Gaynor to hop in here with us and talk about that. Gaynor and I have also talked about why it is that people who have hypermobility might struggle with a prolapse. So we might touch on that today too. But there are so many people who have a prolapse who are not using a pessary for a variety of reasons. And I think that talking to Gaynor is definitely going to make it hopefully a little less scary. I think what's important about all of this is education and really just having the education to understand, like then you can make informed decisions. You can go to your provider and have informed conversations. You can understand how anatomy, posture, and form can actually affect your pessary success. So, and I think a lot of people don't realize that. I think people think, oh, the pessary didn't fit me. But what if the pessary didn't fit because your body is pushing it out because of the forces happening in your body because of a postural pattern? We're not here to shame the postural pattern, but we are here to understand how postural patterns can affect. Here we go. Here's Gaynor coming in. So pessaries, are they made of natural materials? Gaynor would know more about that. Hello!
Hi.
Suddenly, I was like, wait, maybe I need to accept her. Instead of me pretending to be, I was like, I'm just going to say what Gaynor might have said. So Gaynor, let's dive right into it. Let's start with, who are you? Why are we having this conversation? Give us some background.
Okay. Well, first of all, thank you so much for giving me the space to help educate as many women as possible. I'm an RYC teacher and I've done RYC for decades because, what's her name, Louisa first taught me how to squat, because when I was very new to all this, I couldn't squat without holding on to a chair. So here I am teaching it now. And yeah, so it's amazing that OIC has got the capabilities and the staff to do this. So brilliant. So my pessary journey started way back in the late 1980s. And my own mother started presenting with urinary stress incontinence, and she had the transvaginal tape, which is a small operation that lifts up the bladder. And she was fine for about, I would say, 5 years. Now, bearing in mind that my mother was not only my best friend, but she was only 17 and a half years older than me. So we basically grew up together. And she was very young having it. Yeah, she had a lot of ongoing issues after she became incontinent. And I think that comorbidities come because once you become incontinent, things start to gallop ahead in the human body. And back then, she was never offered any exercise classes. She was never offered any physiotherapy. And she became increasingly depressed. to the point that she became suicidal over it, because the doctor, Mum was very proud, and she said, you know, she wouldn't go out anywhere without makeup on. And she'd gone to the GP, and the GP said, you can't be depressed because you're wearing makeup. And that sent her into a spiral. Anyway, cut a long story short, I tried to get her to focus on something other than sort of getting into this dark space. And so she came up and she said, you know, when I'm menstruating, she said, I'm not leaking. She said, it's bizarre. Now, both of us were working. We were both NHS.
Wait, hold on. Repeat that. When I'm menstruating, I'm not leaking. That is very interesting. So sorry to interrupt you. I just wanted to say that point slower, because it reinforces the idea that we are not uniform in our vagina throughout the month, and hormones play a big role in how we experience our pelvic floor and our pelvic floor organs. I just wanted to underscore that statement, because I think there's so much gaslighting in women's health, or female health, I should say. And then this idea that like things are always the same, but they're not. When you're menstruating, you might suddenly be better with your incontinence. Sorry, please keep going with your story. So,
and the reason that she stopped leaking urine is because she was actually wearing a tampon, and it was supporting the urethra. So in the urethra, we've got internal sphincters and we've got external sphincters. So what I want to say at this stage is that if you are leaking stress incontinence, with the external sphincters that have become weakened, certainly restore your core exercises are fantastic for strengthening those, and that can actually help then stop the leakage. Now, if you have had any trauma of the urethra for whatever reason, maybe you've had an indwelling catheter, and if those sphincters, those internal sphincters, because they are made out of different muscle fibers than the external ones, so if they become damaged, then to date, we haven't got any evidence at all to support that exercise will cure that incontinence. But I would not disregard that. Right. I wouldn't sort of, you know, get on exercising. That's what I'm saying. You know, it's worth trying. But with the tampon that was supporting that urethra, it basically, when she had that intra-abdominal pressure going on, there was no involuntary leakage. So we both had the aha moment saying, well, why can't we just, you know, dip a tampon in latex and just go and tell the world that we've got a washable tampon? And that's how it started. So we got some air drying clay, and we had a candle. Bear with me, because there is method in my madness here. And we had a straw, like a McDonald's straw, and a keychain. So that we put that into this mold that became our mold. And then Mum said, well, I need something now to make the product itself. So she had silicone that you, don't try this at home, folks, silicone that you have around the window. And she pumped that in, let it dry. And that was the first Inco stress that was made. So this is an Inco stress. So this is a production that I made and developed further on down the line. But the first one was basically like this, with a loop, because we thought, well, we need to get that out.
So you and your mother developed a permanent tampon to help her deal with her symptoms, because no one else was coming up with solutions. That is incredible. That is an incredible piece of the story.
Yeah. So, and then she put a condom over it for hygiene reasons, and she wore it, and she said, you know, I'm not leaking at all. And it was the first time in years I'd seen her smile and seen her, because she'd got to the stage she wasn't even going out shopping. She was so scared of, you know, leaking. So anyway, we went to all these fairs, and I delved into what materials were body friendly and everything. And I'd never heard of pessary before then at all. I didn't even know what we were going to call it. It went to clinical trial, and 84% of the women on that trial came off the waiting list because we also then started to think it was doing that isometric contraction. And so with that, effectively, we were creating a Kegel as well. So that was helping strengthen. So I developed the exercises, which funny enough, is part of the RYC. I didn't develop your exercises. They just married up very well together. And the results of the clinical trial came out in 2004. A mum passed away just before I spoke to her on the Wednesday morning, before Mother's Day. And in the afternoon, her friend called me and she said she's gone. She died suddenly of a massive heart attack. So, and she was 59 years old. So I spiraled, and I thought, well, I can either hit rock bottom and be no good for man nor beast, or I can do something about it. And I never want to see anybody's mother go through what I went through, and I never want to see any woman go through what Mum went through. So I opened a medical company in her memory called C&G Medicare, Carol and Gaynor. And over the years then, I became Europe's largest pessary distributor. I was knocking on the doors, started to distribute. I had every brand in the warehouse. And I was trained up by the likes of Biotech, all the top brands. And then I started working with them because their information for use leaflet wasn't very user-friendly. So on some of the companies, they asked me to come in and actually help write up the information that goes inside of a pessary. So over the years then, and talking to women, and then fast forward, I developed a rectocele. And they said,
so just for everybody to understand, a rectocele is a type of prolapse. It's where the prolapse is posterior. So it will affect more of the anal region for most people rather than, more forward inside the vaginal region. A prolapse can affect different areas of the vagina. So you developed a rectocele.
Yeah, I think it was because my diet was all out the window. I was a really bad eater, not looking after myself, drinking rather too much wine than I should, and that dehydrates the body in itself anyway. And then with the chronic constipation, of course, then came the weakness, and I wasn't exercising. So with that, the doctors said, well, it was a stage 2 rectocele. So pelvic organ prolapses come in different stages. And so it was to the opening of the vagina. And of course, when I was impacted, it was worse. And I was ending up then, like millions of women, to empty the bowels, you'd have to put your fingers inside of the vagina, push on that posterior wall to support it, to get, what needs evacuating. And so they said, well, there's only surgery. Nobody offered me anything at all other than surgery. And I said, no, I'm definitely not going down that road. So I found a really good physiotherapist. With 18 months of physiotherapy, I'd taken the Restore Your Core program as well. And with Louisa's 6-week in-person course, but online in person.
And Louisa is a Restore Your Core teacher.
Yeah.
Louisa Thomas.
Yeah, she's amazing.
Yes. The Restore Your Core teacher. Yeah, she's amazing.
And so I also had a nutritionist as well that advised me on, what to eat. And she wasn't sort of, don't eat this and don't eat that. She was saying, well, probiotics can help and this can help. And I thought, okay. And slowly then I came off the alcohol. I still drink mine, I know, but it sort of made a lot of sense to me that if I was to reduce this, everything has to come into play. It isn't just about one thing. And within 18 months, I'm back to zero, no prolapse. And a couple of days ago, I had a check with my gynecologist, who's amazing. and she confirmed that I don't have any prolapse. So I maintain my Restore Your Core exercises. I teach it, obviously, and I'm doing the exercises with my clients. So that's basically my story.
That is
and
an
I've got now,
amazing story. Do you also use a pessary?
Yes, even though I don't have a prolapse, and I don't know if this is true for everybody, but I've got an Australian Shepherd dog who's a bit of a puller. So when we go on a walk for like an hour or so, I'll come back and I can feel symptomatic, and I think, oh God, you know, is it starting all over again? Now, that may be just me, maybe other people who have reduced their prolapses, but what I do then is when I know I'm doing like back-to-back teaching, like 1 hour here and then 15 minutes rest and back again for an hour, going on long walks, I will wear a pessary. So I find it helps.
I just want to say a bunch of people are commenting that they were told that prolapse is not, you cannot resolve a prolapse and rectocele. And I just want to say, I said this yesterday too, we are not in the business of promising that it can be resolved, but we are in the business of seeing it be resolved every single day. So in the Restore Your Core community, we have thousands of people saying that their prolapse is no longer there. Now, I'm not in the business, again, of being like, I'm going to fix your prolapse, because that's not how we communicate or talk or promise. But you are here saying that you had a rectocele and your rectocele is now better. I want to ask you, because I'm looking at the time and I want to corral us really well. I want to ask you to tell us about because people are very concerned about pessaries. I want to talk about what are the concerns, and I also want to talk about what are the best practices, because I know you really strongly recommend that people look at their form, their alignment, and do exercises. And we've talked about how even your gait, your walking mechanics can you hear me now? Yeah. We've talked about how even something like gait mechanics can affect the success rate of a pessary. So talk to us about, best practices of using a pessary, and why are people so afraid of using a pessary, and why, what's the what?
I think a lot of times people are afraid of a pessary because they don't know enough about it. A lot of doctors say, oh, it's only for old women, but there is no age limit on a pessary. There's nothing written on there saying you must be, but I do recommend, obviously, that if you're over 16 years old and if you have worn a tampon or a menstrual cup in the past, then it's going to be a lot easier for you. So an adult, but always see a doctor or a women's health physiotherapist, an osteopath, somebody who can internally examine you and have a look exactly what's going on there, because they won't just have a look at what's going on, but they're going to test your the tension in the pelvic floor. Because if somebody is hypertonic, where they've got too much tension, then I wouldn't recommend a pessary. You down train the pelvic floor, then up train and use your pessary, because a lot of people, so this is a cube, this is what a lot of weightlifters use as well, and they come in all different sizes. But going on to gait and things like that, so when I do an assessment of somebody, and it happened the other day, and I actually, we've got a fantastic community of RYC teachers made up of physios and osteopaths and doctors and all, delicious people like that. So going in and saying, look, I've got this lady, I don't know what to do with her. And they're like, oh, have you tried this? Have you tried that? So, drawing down on their knowledge has also helped me become a better instructor. The first thing I'll say is, now let me have a look at how you're breathing. And I am a breathing coach, so we'll have a look at that thoracic mobility. What happens is, so if we put our hands out like a scarecrow, I don't know if you can see that, okay? So the first thing I'm going to have a look at is, are they like this, or are they, oblique dominant, where they're thrusting up their ribs like this? So we'll just sort of look at that, and then I'll have them sort of one hand comes up and your head follows the arm that comes up and the arm comes down. So what I'm looking at is further down. I want to see, is there any natural internal rotation of the hips? Are the hips swinging around? So it's a compensation pattern to get the thorax over here. Or are they stiff like this? And I'm looking at their glutes and they're holding on to their glutes for dear life and they're kind of like this, you know, oh, can't move my hips. So that would indicate to me as well, if they've got a pessary in and they haven't got that natural flow of their hips coming in like this, then I think, right, okay, we've got a gripper here. So we'd start to look at then how that person is walking, how the gait is, having a look if there's any pronation or supination of the feet. So we're looking right
Can I stop you for a minute?
Chain. Yeah.
I just love to always summarize. I just love to always create like a context because it's so much information. So you're the well of information. I'm like going to just summarize. So basically, I think what you're saying is one of the big issues with people is that they go to get a pessary, but their pessary provider is not looking at the whole picture. They're just looking at part of the picture. And then they're not looking at what their alignment, rotations and spins and turns and twists might be, which would be creating downward pressure, gripping, internal rotation. You know, the rotation of your pelvis, my friends, the rotation of your hips will push your organs forward and backwards. So I think what you're saying is you're doing a full-scale assessment to see that the pessary is going to be successful. You're not just, you know, encouraging them to put it in and walk away. It's no surprise that people with hypertonic pelvic floor and prolapse also push out tampons, but it's not because they're not pushing the tampon out because they have a prolapse. They're pushing the tampon out because something in their body is creating too much force, tension, and downward pressure to keep the tampon in. So the pessary needs to also be treated in that way. That's what I'm kind of hearing you saying. But you developed, from what I remember, this technique is very specific to you. Not all pessary providers will look at all of this stuff, right?
Yeah. And it's important because we're on the outside of our bodies, we've got proprioception. Our bodies are always looking for space. And you taught me that in the teacher training, you know, it's like you're reaching out for a mango and look at that patient, that client's hips. Are the hips trying to help the arm go up there? And sort of, it's the same with the pessary. We are not 2D drawings. The pessary inside the body will also look for space. Yes. You can't expect a pessary just to sit there like a little bit of scaffolding. It will think, oh, there's a little bit of space over there. She's not looking. I'm just going to jump over there now. And before you know it, it's like my pessary has slipped out. Why? A lot of the times when you are gripping all the time, you're fatiguing the muscles. So then that's another problem. When you've got fatigue in the muscles, your pessary will move.
Yeah, exactly. So that's so interesting. So when people have a pessary, if they haven't been successful with it, you're going to suggest they then kind of don't just give up because a pessary can really work for so many bodies if you're taking care of the same like what you do in the Restore Your Core work, right? What are the underlying conditions that are leading to all that pressure? So I may have lost Gaynor for a second. It looks like your connection, Gaynor, if you can hear me, is out-ish. So I'll keep talking. Why not? So when Gaynor and I were talking the other day, one of the things that Gaynor said, which I don't know if Gaynor is still hearing me, was that, as she said, butt gripping is a really important factor. So you want to be looking at factors like butt gripping, internal rotation of the femurs, external rotation of your hips. If your ribs are tight and you don't, Gaynor was talking about breathing, right? So those are things that I really want you to be considering. I also wanted to say that, and Gaynor was going to talk about this, but she's gone for now. I also wanted to say that one of the things that's really important is using the complementary use of exercise. It is so important that if you are using a pessary, you absolutely also want to be, it's not a stand-in for pelvic floor exercises and pelvic floor integrity. So you've got to be doing both. I don't know if we're going to get Gaynor back, so we will post this video live on the feed, and you can ask as many questions as you want, and we will do our best to answer them. Gaynor is super active on Instagram, and I know she'll respond here, but I will reiterate that the pessaries work really well when used in combination with experts who know what they're like, experts who really understand body mechanics and posture and form and breathing, and then doing your exercises. Those are the things you have to consider. And if you're not doing both of those things, then it's possible that the pessary won't work for you and you try it once and you just give up because it didn't quite work. So thank you all for joining. I'll turn the live off now, but we will connect in the chat and we will continue to answer all of your questions about Gaynor is going to, when I post this, her handle is Pelvic Angel. So you'll find her. I'll put her in there. Don't worry. Okay, my friends, thank you so much for joining. It's been a pleasure. We'll see you soon.